We need support from our federal partners. And today we reiterated our call on Canada's Canada's premiers, led by Premier Horgan over much of the last year and now by Premier Stephenson, for a renewed healthcare funding partnership with the federal government delivered through the Canada Health Transfer. The degree of unanimity and support for this over a period of months as we have waited for any federal response has been a source of strength, demonstrates the willingness to focus on what matters to people, which is the quality of care and the delivery of services, is demonstrated again today by our united and common approach to see a change in the Canada Health Transfer and an increase in the Canada Health Transfer such that we can meet the demands of the future. The united position of Canada's premiers seeks to increase the federal government's share of provincial and territorial health costs to 35% and to maintain it at this level going forward. And so we are looking forward, of course, to meeting with the Federal Health Minister, Minister Duclos, tomorrow. We've heard, as all of you will have, a willingness by the federal government to increase its share of the Canada Health Transfer. And of course, the federal government saying that they are prepared to invest more is good news. And we look forward to seeing details. We hope that such an announcement and any discussions we have tomorrow lead to what we have been wanting and expecting for months, really since one was promised and announced in 2015 in the incoming government's election platform. A First Ministers meeting on the Canada Health Transfer where we talk about the future of healthcare in Canada and raising that health transfer to meet those needs. So I am, of course, on behalf of ministers, pleased at the news that there may be more money and anxious and happy to look forward to our discussions with Minister Duclos tomorrow and hopefully a future federal, provincial, territorial conference on the Canada Health Transfer, which will come from there. Well, what we want to see is a national meeting. And unlike at times, and we've never heard this really directly from the federal government, we're prepared to have that meeting without preconditions, right? So we're prepared to have a national meeting. But let's be clear. I mean, what we've seen is the decline in the Canada Health Transfer over time, such that it has put, I think, serious burden on the delivery of services to people. So we're absolutely prepared. I am hopeful, and obviously we'll be hearing more from Minister Duclos in the next period. I'm hopeful that their willingness to step up and have a discussion about the Canada Health Transfer will lead to a First Ministers Conference with what we need and a positive outcome for healthcare in Canada. So, you know, I haven't, and I've always said, and I always believe, and Premier Horgan has always said, and all the premiers have always said, that we expect, after years and years and years, and now a full year of calling for this, that the federal government will agree to such a meeting, and we'll look forward to having those discussions.